I'm sure that instructors like me have faced physical and medical challenges in their training while they are training or while they are training their clients. So there are a lot of conditions we can talk about, but today I want to pick up two major conditions which I have seen in my experience. So the first one is the joint dislocation and the second is the dizziness. So in these two situations, sometimes we don't understand that what position the patient can get a rest, at least till the medical services come. So I would like Dr. Adarsh to give some opinion on this.
Thank you very much, Shraddha. I'm really grateful that you have raised this very relevant question. To be specific, you have mentioned about joint dislocation and about dizziness. First, let me pick up joint dislocation. One of the common joint locations is shoulder joint dislocation. Now, the position of the head of the humerus could be out of the socket front, that is under the clavicle. This is an anterior joint dislocation. Or it could be behind. That could be a posterior joint dislocation. Why I am talking about anatomy is that the position of rest and thereby the position where the patient would have relief of pain would be different for both conditions. Now, the eye sees what the mind knows. In this particular program, this is what we are targeting, where we would give relevant explanations and demonstrations of how to deal with such a situation, how to give your patient a safe position, a position of pain relief until the paramedics from the national ambulance or hospital is accessed. All right. So this is about the shoulder dislocation. However, one attempt at joint dislocation reduction can be done by a trained person, but with caution, and that comes with conditions where the person is trained and experienced. Coming to the second example, which you stated, that is about dizziness. Dizziness or syncope or lightheadedness, it's a very common condition which can be faced by your middle-aged or elderly clients. The primary reason could be pre-existing cervical spondylitis or their dependence on some cardiac or antihypertensive medication. This can lead to venous pooling of blood, and in case there is venous pooling of blood, then it is very simple to deal with it on the spot. Put the patient in a supine position, and supine means put the patient on the ground with the back on the ground. Rest the hands and the legs in a straight position. Gently raise the legs from the hip upwards. Allow the blood from the legs to flow into the body, and it will gently flow up to the brain. Most of the patients recover with this maneuver. In case there is a recurrence or the patient is not recovering comfortably, do not waste any time. Reach out to the ambulance, reach out to your associated medical care, and transfer the patient safely. I hope these pointers are practical and you find them useful in your daily practice.
Definitely, it was really helpful, and I guess this is going to be helpful for all the instructors like me.
And I would appeal to all instructors who are practicing different kinds of sports, teaching different kinds of genres in sports, to take up the sport paramedic program, to be able to deal with these challenges effectively and keep their clients happy, keep themselves safe. Thank you.